Wala, and you are watching Abundance Show. And this is an amazing episode for those who are pursuing medical career, those who are medical professionals, and anyone in my country or globally they want to pursue a career in United States of America and in other states also abroad in the better economies than theirs. So this episode is for you. So with us is Dr. Manu Matthew. Manu, how are you doing?
I'm good. Thank you for inviting me to your show. You're doing wonderful things, of course. I do follow you and see you discuss several topics, not just medical, but many things. So, applaud to you and all the work you're doing.
We are honored to be joined by Dr. Manu Matthew, a medical doctor, a passionate advocate for healthcare policy and medical graduate education reforms, with years of experience across healthcare, pharmaceutical care, and legislative advocacy. Dr. Manu has been working to create better opportunities for international medical graduates while contributing to meaningful reforms that strengthen the healthcare reforms. And in today's conversation, we'll explore the future of medical education, healthcare policy, leadership, and the impact that one person's vision can have on entire profession. Dr. Manu, thank you so much for joining us. It's a pleasure to have you on the Abundance Show. Would you like to tell us a bit about yourself and your journey?
Yes. So my name is Manu Matthew, as you clearly stated. I am a medical graduate. I went to med school in American University of Antigua, which is located in the Caribbeans, in 2012. I tried to apply to the match for several years, and I was not able to. During the pandemic time, I was with several advocacy groups where we advocated for more residency slots. That is the priority for several of the organizations, and it is a priority to me as well that there should be more funding. But that takes a long time to get money from Washington, D.C. So I, out of my own liberty, with several others who helped me, we reached out to state lawmakers um, to find solutions to this issue where you have the entire world applying for residency, medical residency, and which makes it highly competitive. But the real question is the system really designed for the entire world to apply? And then the real answer is no, it isn't. So what we came to solutions are that people who are foreign trained physicians in several countries, they can bypass residency is one solution, and then those who don't who don't match into residency, they can work under the supervision of a physician. So even that, you have to have a permit or license or some sort of legislation for them to gain experience or not lose all that knowledge over the years. So because once you finish 4 years of med school, then you should get into residency. And if you don't, what you learn, you start to lose. So clinically, you start to lose that knowledge that you gained. You shouldn't. You shouldn't lose that knowledge, in my opinion. So, yes, ask your questions.
Thank you so much for diving deep into the policy, into the medical care, and those who just end up in entering USA, and then they have challenges for the pursuing their career in medical field. And my first question is, Dr. Manu, could you take us back to the beginning? What inspired you to pursue medicine, and what led you towards healthcare policy and advocacy rather than following a traditional clinical path?
Well, medicine is amazing where it's a global thing, right? You can, when I studied in medical school, I was studying with people all around the world, people from India, people from Pakistan, people from everywhere. So it's a universal language where you can connect with everyone, and plus you make a tremendous difference, right? You can manage a disease, diagnose a disease, treat a disease, and make a, a big difference in that person's life. That is why I really pursued it. But there's limitations, as I stated in beginning of the podcast. Is it's not designed. There's not enough money for the whole world to apply to get into residency. So people eventually get unmatched. People from United States or people from around the world. So I got passionate about advocacy because I feel I can make a difference in that front rather than patient. If I can never get matched, then all that work, all that knowledge about that selection process to finish residency is just going to be a waste. So I want to make a difference through policy. And it was very, and I feel that I am making a difference.
Thank you. Thank you so much for your passion. My next question is, graduate medical education reform is one of your major focus area. For viewers who may not be familiar with it, what does it mean? Why is it so important, and how can improve opportunities for future doctors, especially
Of course.
international medical graduates?
For example, when we were speaking, um, we're competing with people with several years of experience, right? And I don't have that experience. So why am I competing with someone who has been treating patients 5 years of experience in your country or other countries? It just doesn't make sense that we're all trying to be grouped in this one pool, and then we're all competing, and there's always going to be a mismatch. So these are solutions that make sense and is being passed in several states for foreign trained physicians to bypass residency. About right now, I think it's about 28 states have passed it, but each state has different stipulations.
Thank you. My third question, from your experience working with healthcare professionals and policymakers, what do you believe are biggest challenges facing today's healthcare system, and what practical reforms would make the greatest impact?
So, first is global training recognition. If we figure out in each country, for example, if in United States, is it equivalent to U.S. standards, then we can make sure the people who are applying from your country don't just apply to residency, they can bypass residency. That saves dollars, US dollars, and they can work under a physician, supervised physician for approximately 2 years. And Medicare funds would not be wasted on that. And more slots start to open up for people living in United States. So what the solution you're talking about in US. Now globally, you're asking me about globally or USA?
As typically USA and generally global, if you can respond to global
Yes,
system.
so global is different. So the way this selection process of every country is not the same exact way. I believe in Pakistan, once you finish your 4 years, you get an MBBS, and you start to work. You're able to work. In the United States, there's a barrier to that. You cannot just start to work. You have to go through this cycle called the match. And then you have to spend money to just be trained. You understand? Just to get trained, I have to compete and spend money when a lot of the individuals in the United States have loans. So it doesn't make any sense that people who are in loans and who have not gained money, and then once you get trained, they're not getting so much money either. So it's a very harsh system in USA financially. In different countries, I believe it's a little bit more easier. There's an easier transition. When you finish your med school, you're acknowledged and you can move forward in progression. There's not like a dead stop. Well, in America, there can be a dead stop. And what I'm trying to do with several other organizations is there is no dead stop. You can grow.
Okay, thank you. I like to know more about this data stop. Probably this is just because of the policy, but before I like to ask, leadership often means creating change in difficult environment. Throughout your journey, what has been your biggest lessons about leadership, resilience, and staying committed to purpose, the benefit of others?
What's the importance of leadership? You're asking. This is requires definitely leadership. Myself and several other organizations. The challenge is always there's always opposition when you're dealing with policy work and lawmakers. People will always oppose, and then there's always people who support. So you have to acknowledge both sides in when you're working as a leader, and see if you can work with the opposite side, not just find only the people who support you, and see if you can come in the middle and work together. And that's what a leader is. It's not just trying to get a bunch of people who just support you. See what they oppose, and see if we can work together.
Thank you, Manu. Many students and young doctors dream of building an international medical career. What active would what advice would you give them about preparing for the future, developing the right mindset, and creating meaningful impact in the healthcare?
I have studied with people all around the world. I can, when I during my study years, I can so many different countries I have studied, different study partners I had, and what I feel is it's a privilege where once you finish your career, I feel there's an echo. Okay. One good thing is it can make a true difference in your own country. While you're in your country has given you the confidence in your skills, and to the max wherever you are, whichever country you're in, make a true difference in your country before just trying to go to different countries. Make a difference for your people is what I say. Once you finish med school, when you pursue that, don't just say, okay, well, I want a better life, but you can improve your lives wherever you are. So that's also my important take I always wanted to say, because I'm envious as well when I study with someone from India or Pakistan, whichever part of the world. They always tell me, oh, I've been taking care of patients for X number of years, and I'm just studying this because I just want to improve my life. And what does that mean? Improve their life financially. But their lives are okay in their lives where they are, right? They're helping someone, they're making their health better in that country. So, not to just quickly jump. I know each country has issues and problems, but and you want to go somewhere else with less problems. But still, no country is perfect.
Thank you so much. Before we wrap
Oh,
up,
one second. I didn't hear you. So, okay, go ahead. Yeah.
okay, before we wrap up, if you could leave our audience with with one message above purpose, about your purpose, leadership, and creating positive change in the world, what would that message be?
Work hard, whatever you believe in. If it's health policy, if it's to become a doctor, or if it's yourself, your podcast, push yourself. There will always be people who oppose. It's okay. You want people who oppose. You become a better person with some of that opposition, and you grow. And that's the most important thing I can tell you. Keep on pushing despite people who oppose you. Continue
And
to grow.
thank you so much, Dr. Manu. Could you please once again give us a summary? What help can you render to the economies like our country, like India, Pakistan, Bangladesh, Bhutan, Sri Lanka, or Southeast Asian countries, or other economies of our level? How can you be abundantly available to the students, to the
Oh,
doctors, to those who are pursuing medical career, especially in USA?
so anybody can reach out to me, and there already are so many people internationally from different countries reach out to me about they want to learn about the process in the United States, on what the match is, and what to prepare. I can help them connect with people, so they're readily a bit available. With the proper resources, I can be a guide to anyone.
If you could get us some get my audience some contacts, be it LinkedIn, be it your email, or
Okay.
whatever medium
Okay.
you want
No
people
problem.
should interact you with.
No problem.
Okay, so it's better. I'll just putting your information regarding LinkedIn
Okay, no
to
problem. You
contact.
can share my LinkedIn, and then I can give you my email address.
And anything else, if you want, you can give me number. I can just put in the descriptions
Okay.
for the facilitation of my audience. And just because people are spending billions of rupees here in my country and in my neighboring countries too, in the medical profession, and you are such a blessing that you can be their savior of their lot of money. They're that going down the drain. So
So let
thank
me
you.
ask you a question. In Pakistan, how is healthcare system there? Meaning, I want to learn a little bit before we wrap up about your country. Is Do you get good healthcare there?
Well, I mean, I,
Yourself or your family or friends?
I mean, probably I am not the right person to respond to such an important question. This is, in fact, a really policy question, and speaking about entire country's policy, or it's beyond my scope and my wisdom and my experience. Neither I'm medical doctor or I'm nowhere close to commenting on it. But my experience, like I mean, it is improving, and even the provincial governments and the national government, they are doing amazing things. And though we are a bit slow, just because of the economical uh, problems are there, is the global. This is a global phenomenon anyhow, and these are being faced by any economy. So same. We are no exception. But at the same time, I like to disclose you one fantastic fact about my medical industry, that I have the real first-hand knowledge, that we are 40 to 70% cheaper than America, Canada, Europe, or any first world countries. So there is a huge, big medical tourism waiting ahead, and we can be abundantly responding to the medical treatment. I have personally interacted with medical doctors, with the neurosurgeons, and even the beauticians, and they are now the people are in the beauty industry also. The lot is going on, and trust me that my country is not only dependable, but there are people, they keep coming from UK and other part of the world back to kind of my country, and they come for treatment, and they tell us it's easier, it's cheap, much cheaper, and it's much more comfortable, just because the policies keeping us everything political aside. So this is something that I am really proud of presenting you. The 40 to 70% is cheaper, dependable. So if possible, I would invite your thoughts on medical tourism from your country, from USA to my country, Pakistan. I can get you connected the real professionals, the neurosurgeons or the board of or medical board or the dignitaries in the government who are really looking for this. I can get you connected. That's really very much possible. So give me your thoughts on this. If you ask me a question, that's how I can respond.
So yes, insurance is very expensive in the United States. It's a very complex topic in America, and it's an ongoing issue with everything is costly. They're taking basically money from our paychecks um, each month or each biweekly. When they're taking our paycheck, we're contributing to Medicare or Social Security or income taxes. So this is how the system is designed, and it's very expensive. It's a very expensive system. Versus medical tourism is a solution for several people who can't afford insurance in my country and will revert to different countries where it's cheaper. So yes, it's very popular. I've heard a lot about it. Where going to a different country, you can save a lot of money. You don't become broke in America. So yes, it's one solution to an ongoing issue in our country. So like I said in the beginning, we have our own issues in our country. It's not a perfect system, even in America. So there are pros and cons in every country, and obviously, one of the good things is we can go to your country or different countries and save money.
Yes, sure, Dr. Matthew. Since you are in USA and you're advocate for the medical care, healthcare, we can kickstart medical healthcare cities, medical cities, and in my country, even neighboring you, even we are neighboring India, and this we've got beautiful places very close by. Like in the capital of Pakistan is Islamabad, and yeah, it's very close by. There are so beautiful places as long as tourism itself is concerned. Like 3 hour drives can take you to world's best place in my country, and it's close by Islamabad. And Islamabad is full of medical. It's a medical city, I would say. You would find healthcare facilities to the epic. And do think about this. Let me know. And
Medical tourism.
for
Let me
sure,
ask you a
I
question.
ask.
Medical tourism, is it you accept people from different countries, meaning, or it has to be a Pakistan national only where it will happen? Will take people from all around the world?
The people in Pakistan, they are already getting these facilities. The government is taking care of the nationals surely. But I'm talking about the international. Like I mean,
Okay.
in your country, it's very costly. It's
Yes.
very expensive in UK also. The stronger the economy,
Mhm.
the difficult is the healthcare. I understand. I've got lot of people. Well, since I keep podcasting people globally, so I have got like in discussions, and I keep inviting people to my country, be it medical tourism, be it tourism, be it trade, finance, be it tech. So even e-commerce, I mean, we are world best people in my area. So I would ask you to bring any sort and kind of business, anything which is legal and moral to my country. We are too open, and we really need this. This is need of the hour. So we are struggling economy, and we've got big heart, and we are, what we can do is like, I mean, two people can get the medicine or the treatment in at the cost of one in your country. So that I can show you, even we are more cheaper. If you have
Of
got
course.
questions, I can respond, just because I've been connected
But,
to the
but
friends
you
in
don't
my
have a
country.
system in Pakistan where you have to pay monthly, like insurance or anything like this. Are you mandated where you have to pay insurance, or they'll take from your paycheck if from your employer has to? Is there a system like that in Pakistan?
Yes, there are like more than one, like employers, they are bound to pay that medical insurance to different companies, and government is doing same. And even those who are not employee, or they are not connected to some particular system, as long as health insurance or the medical treatment, or the hospitals or any healthcare facility directly involved to them. But as general public, the government is taking care of them. Even any person can go to any hospital with CNIC, that national identity card, having Pakistani, being Pakistani national, can have the treatment up to 1 million rupees for free, just because the government is already paying for each and every individual as an insurance, health care. And this is the older figure. Even I need to update the knowledge. Probably I think it has gone even beyond that. So that's this is what is amazing factor that government is doing. There are a lot of great things are happening in our country, but Magdala keep attracting to the negative news. So I can respond to a little more questions if you have, else we can.
That's all. That's all. That's the only questions I have for now.
And how about if I can ask, although it is a repetitive question, but again, what facility you have, or how can you save money? The people who are spending a lot, they want to go to United States and for USMLE, and later on they have got the problems that there are surgeons going from my country, and they do not get the job of surgeon, or whatever their specialty is in your country. How can you save their money and still keeping them in medical industry?
We're that is what we're trying to solve. This well, the majority of this podcast is the foreign trained physicians can, once they prove that they have been working a certain number of years, they can start to work under the supervision of a physician. But each state is different. Medical boards determine the rules for every state, so they have to look. Or anybody who reaches out, I can help them, guide them based on their experience. So they get to start to earn some money when they come.
Thank you, Dr. Matthew. Is there
But
any?
you have to pay for your USMLEs and everything. Yes.
Surely, I mean, that the government fee will have to be paid for
Yeah.
USMLE
Yeah.
or other which governmental fee, or any. The people generally, I mean, I see they are ready to pay the legitimate fee, whatever. But I mean, there are agents or some intermediary people, and the middleman. They're looting lots of money from the people's pocket, which is making it even more miserable for the parents, and for even for themselves. So, what facilities, or what blessings can you bring to my teaching hospitals in my country?
When you say facilities, you mean clinical rotations? Are you talking
It may
about?
be clinical rotations, like, I
Yes.
mean, is there any exchange program that
Yeah,
from
yeah. So
my
there's a
medical
lot of
colleges to your
there's
medical
I
colleges?
myself I myself are offering clinical rotations for individuals through when they come here, they can observe. The key word is they can observe what how the system is in America, and then they can go back and they can apply for residency. And a lot of hospitals are offering observerships. If that's what you're asking, I believe.
And does it lead to employment in USA?
Yes, well, residency is one form of employment. Yes, training. You get to train. Yes, that's an employment. Yes,
Dr. Matthew, I would like to
but
podcast
there's
you
two different
again
individuals.
on this
There's
particular.
students. Yeah, there's students who finish from your schools who don't have experience and directly come. That's one people, and then there's individuals who have experience and have been working in your country. So two different scenarios we're talking about. The students who finished, and then there's people who are licensed in your country working for several years. So we cannot combine them and say they're one individual.
Thank you so much, Dr. Matthew, for deeping dive and getting us to know what's happening in United States of America and what facilities or what blessings can you extend towards my country and the people who
Yeah,
are directly or indirectly into the medical or paramedical field are there and they want to pursue the career in United States of America through USMLE or some other licensing. So I'll keep you podcasting, and we'll keep exploring the opportunities between both the countries. Uh, let's see how next. This was just a starter. So see you soon
yes.
again, Dr. Matthew. Thank you so much. Stay blessed.
Okay, thank